okay, picture this. You've got a prize animal, maybe a young bull you're really counting on, and he just seems a little off.
Mm-hmm.
Then just hours later, he's in real agony, like fighting for his life. That simple discomfort, it's suddenly a massive crisis.
Yeah, it can escalate incredibly fast.
So today, we're doing a deep dive into exactly that emergency.
Yeah.
Urolithiasis in cattle. Most people probably know it as urinary stones.
That's the common term, yes.
And look, this isn't just some minor thing. It's actually a really serious, potentially fatal metabolic disease.
Mm.
And it seems particularly tough on the male cattle.
You've really hit on a crucial point there. Our mission today in this deep dive is to unpack, the complex mix of factors that lead to these stones,
Okay.
how to spot those crucial signs early on, and crucially, what can actually be done to treat it, and maybe even more importantly, prevent it.
Right.
And we're drawing on quite a bit of comprehensive veterinary research here, trying to give the clearest picture possible of what's happening sort of beneath the surface.
Okay, great. So let's start right at the beginning. For someone who's maybe just heard the term urinary stones in cattle, what is urolithiasis exactly? Are we literally talking about rocks forming inside them?
Essentially, yes. That's a good way to think about it. We're talking about the formation of urinary calculi, which literally means stones, somewhere within the urinary tract.
Wow.
And they're not just uncomfortable. These things can cause a partial or even a complete blockage of urine flow,
Right?
which turns a normal bodily function into, well, a life-threatening situation pretty quickly.
And it's fascinating you mentioned male cattle being especially susceptible. Why is that? Is it just pure bad luck, or is there something specific about their anatomy?
Oh, it's definitely anatomical. Their urethra, the tube urine passes through, is much longer and narrower than in females. That plays a huge role.
Ah, okay.
And specifically, there are two common spots where these stones tend to get stuck. One is the sigmoid flexure.
That S-bend, right?
Exactly, that S-shaped curve. It acts almost like a natural trap. And the other spot is the urethral process, which is right at the very tip. These narrow points just make it incredibly difficult for stones, even smallish ones, to pass through.
So given that anatomical hurdle,
Mm-hmm.
are certain groups of male cattle even more at risk? Who should a producer be really watching out for?
Absolutely. This condition is a really common cause of urinary tract issues in feedlot cattle,
Okay.
also in young bulls, and in castrated males, steers, basically.
Great, sisters.
Their management, the kind of diets they're often on, it really predisposes them. If you think about the bigger picture, it shows how certain farming practices, even if well-intentioned for growth, can inadvertently create these kinds of health challenges.
That leads perfectly into the next bit, because this is where it gets really interesting, I think. We get what it is and who's most vulnerable. But the big puzzle for a lot of folks is why. You mentioned it's rarely just one single thing. Can you kind of break down this complex web for us? And maybe what's the biggest misunderstanding people have about why these stones actually form?
That's a great question, because I think a lot of people just assume it's about, not enough water, which is part of it, but not the whole story.
Right.
The hidden truth, the real aha moment, often comes when you understand how seemingly small things in the diet, like getting that calcium to phosphorus ratio right, can be the absolute difference between a healthy animal and a critical emergency. Stone formation is, it's genuinely a complex interplay. You've got diet, metabolism, environment, all interacting.
Okay, so dietary imbalances are a huge piece of this puzzle.
Mm-hmm.
What specific kinds of diets tend to throw that balance off?
Well, the big ones are high-grain, low-roughage rations. These are really common in feedlots, designed for rapid weight gain.
Yeah, makes sense.
These diets often end up being high in phosphorus and magnesium, and this is kilo in calcium and potassium.
Yeah.
And the critical number to remember is that calcium to phosphorus ratio. If it drops below 2 to 1, so less than 2 parts calcium for every 1 part phosphorus.
Less than 2 to 1. Got it.
That's a major risk factor for the most common type of stones, which are phosphatic stones.
Wow, that's a really specific ratio. And I'm guessing it's not just, a stone is a stone. Do certain diets clearly lead to specific types of stones, or is it more mixed?
No, there's definitely a strong link. For instance, struvite stones, those are magnesium ammonium phosphate. They're very often linked to those high-grain, low-calcium diets we just talked about.
Okay.
Then you have calcium carbonate stones. Those are actually common in cattle grazing on forage that's really high in calcium, like alfalfa.
Interesting. So even natural forage isn't always perfect.
Exactly. It's about the balance. Then there are silica stones, which, as the name suggests, form from forages that are naturally high in silica. And finally, oxalate stones, which are much rarer, typically come from eating specific oxalate-rich plants.
Huh.
So yeah, the diet can almost craft a specific type of stone.
So beyond the diet itself, what other factors are feeding into this? Reduced water intake feels like an obvious one,
Well,
but maybe it's not always just about the trough being empty.
it's a huge one, absolutely. Dehydration means more concentrated urine,
Right.
and that dramatically increases the chance that minerals will precipitate out and form stones. But yeah, it's not always just a lack of water. Think about practical things like maybe the water source tastes bad, maybe due to algae or something,
Okay.
or contamination. Or in colder climates, it could simply be frozen. So
Yeah.
the animal wants to drink, but physically can't or won't drink enough.
That makes sense. And urine pH, that sounds like a particularly tricky factor. How does that work?
It definitely is nuanced. Think of it like this. A high-grain diet might make the animal's overall system, like its blood, slightly more acidic. But paradoxically, inside the bladder and urinary tract itself, it can actually create an alkaline environment. And that alkaline condition is exactly what struvite stones love. They need it to form.
Wow, okay. So it's not straightforward.
Not at all. And other stone types, conversely, prefer different pH levels. So the diet's influence on the urine pH can really steer which type of stone is most likely to develop.
And what about vitamin deficiencies? How does something like a lack of a vitamin end up contributing to a physical stone?
Well, vitamin A deficiency is the one to highlight here. A lack of vitamin A can cause cells lining the urinary tract to sort of slough off.
Okay.
These dead cells then act as a nucleus, like a starting point. The initial mineral crystals have something to latch onto and grow around, eventually forming larger stones.
Huh. It's a great example of how something seemingly unrelated can directly contribute.
Exactly. A distant health factor impacting a very specific problem.
So let's switch gears to detection. If you're a producer, how do you know if an animal might be developing this? Recognizing those signs early sounds absolutely critical for a good outcome.
It truly is. It can honestly be the difference between a fairly minor intervention and, a catastrophic loss.
So walk us through the symptoms. What should people be looking for in those very early stages? What might a rancher actually see out in the field?
Okay, so initially, a rancher might just notice the animal seems restless, maybe signs of abdominal pain, kicking at the belly, stamping its feet, or just looking generally uncomfortable.
Right.
A really key indicator is straining to urinate. The technical term is stranguria. They might try, but only a little trickle comes out, or maybe nothing at all. Or they might posture frequently, trying to urinate without success.
Okay, straining is a big one.
Huge. You might also see them swishing their tail a lot, kind of wringing it. Sometimes teeth grinding, that's called bruxism.
Teeth grinding, wow.
Yeah. And occasionally you might actually see blood-tinged urine, or even notice little crystals stuck to the preputial hairs near the opening. That's very telling.
Okay, those are the early signs. What happens if it progresses? What are the really critical emergency signs that mean things have gotten much worse?
Well, as the blockage continues, the condition deteriorates, often rapidly. A very advanced sign is abdominal distension, which people often call water belly.
Water belly. Okay.
And this can happen in two ways. If the urethra ruptures, urine leaks out into the tissues under the skin, causing the swelling, usually under the abdomen.
Oof.
Or, even more severe, if the bladder itself ruptures, urine starts accumulating inside the abdominal cavity. That leads to a very noticeable pear-shaped abdomen. I've seen it happen incredibly fast. It's really alarming.
That just sounds incredibly severe and painful for the animal.
Oh, it absolutely is. Beyond that distension, you'll see clear signs of depression, loss of appetite, the term is anorexia, and severe dehydration. Eventually, they might become too weak to stand, they become recumbent, and if it's still not treated, uremic toxicity sets in, meaning waste products that should be leaving in the urine build up in their bloodstream, basically poisoning them from the inside out. This leads to severe lethargy, weakness, potentially even toxic shock. And if infection takes hold, you can get peritonitis, a dangerous inflammation inside the abdomen, or even septicemia, which is a full-body blood infection. At that point, death can follow very quickly if there's no intervention.
Okay, so it's incredibly serious. Let's talk treatment. Once an animal is diagnosed, what are the options? It sounds like it really depends on how bad it is and maybe even the value of the animal.
Exactly right. The approach really depends heavily on the severity of the blockage, exactly where the stone is lodged, and yes, the animal's economic or breeding value. Some procedures are more costly, or they might have long-term consequences for, say, a breeding bull.
Right. So for maybe a partial blockage, is there a medical route, something that avoids surgery?
Yes, sometimes, especially if it's caught very early or if the obstruction isn't complete. Medical management can involve things like antispasmodics and tranquilizers.
To relax things.
Exactly, to help relax the urethral muscles.
Mhm.
Also, anti-inflammatory drugs, often NSAIDs, non-steroidal anti-inflammatory drugs to bring down swelling and pain. Okay. And fluid therapy is often crucial to correct dehydration and electrolyte imbalances. That's especially vital if the bladder has ruptured.
Makes sense.
For phosphatic stones specifically, you might use oral ammonium chloride to try and acidify the urine and help dissolve them, but that won't work for other stone types. And sometimes diuretics are used to try and flush out very small calculi.
But for a complete blockage, it sounds like surgery is pretty much unavoidable to save the animal.
That's generally true, yes. For a complete obstruction, the main goal of surgery is simply to reestablish a clear path for urine to get out.
Right.
There are several procedures. If the stone is stuck right at the tip in the urethral process, sometimes an amputation of just that small tip is possible.
Okay.
For steers that are headed for slaughter anyway, a common salvage procedure is called an ischial urethrostomy. This creates a permanent new opening for urination lower down.
A salvage procedure. Okay.
But importantly, it means a bull can no longer breed naturally, so it's not ideal for breeding stock.
Right. So what about if you do want to save a valuable breeding bull? Are there options that don't compromise his future ability to reproduce?
Yes, in that case, a tube cystostomy is often the preferred route. Here, a tube is surgically placed directly into the bladder, allowing urine to drain out, bypassing the blocked urethra.
Ah, okay.
This lets the urethra heal without permanently altering the anatomy. It's definitely more complex, more involved surgery, but it offers the best chance for that bull to recover full reproductive function later on.
Gotcha.
Other options, depending on the case, could include a cystotomy, where they actually open the bladder to remove stones directly, or sometimes in small ruminants like goats or sheep, something called bladder marsupialization, which creates a permanent opening from the bladder to the outside.
Okay, quite a range of surgical options then.
Yes.
Beyond the main procedure, what about just general supportive care during recovery?
Oh, supportive care is absolutely vital, regardless of the treatment method. This means ongoing pain management, usually with those NSAIDs we mentioned. Antibiotics are often needed to prevent or treat secondary infections.
Right, infection risk must be high.
It can be, and crucially, strict dietary management after treatment is key to prevent the stones from coming back. It's not just about removing the current blockage, it's about stopping it from happening again.
Which brings us perfectly to prevention. We've covered causes, signs, treatments, but like you said earlier, the most crucial part is probably prevention. What are the main strategies a producer can actually use to try and avoid this whole crisis?
Absolutely. Prevention is, without a doubt, far more effective and certainly more economical. It saves animals, it saves resources, and what's kind of empowering here is how much control we do actually have over many of the contributing factors, especially diet.
Okay, so balanced rations are critical.
Mhm.
Remind us of that golden rule for the calcium to phosphorus ratio.
First and foremost, you absolutely must ensure that dietary calcium to phosphorus ratio is at least 2 to 1, maybe even a bit higher, like 2.5 to 1.
At least 2 to 1. Okay, non-negotiable.
Pretty much, for prevention. You also need to avoid feeding excessive amounts of grain and make sure there's plenty of good quality roughage in the diet. That helps not just with mineral balance, but also overall gut health and saliva production.
And water. Seems like keeping things flushed out would be huge here.
It's absolutely vital. Constant access to clean, fresh, and palatable water is critical.
Palatable, right. Not just present, but appealing.
Exactly. You want to encourage drinking to dilute the urine and promote frequent urination. That helps flush out any small crystals before they get a chance to clump together and form larger stones. It sounds simple, but checking water quality and accessibility is often overlooked.
Are there any other dietary tweaks or additions that can help prevent stone formation?
Yeah, a couple of things. Increasing salivation can help. More long-stem roughage in the diet encourages chewing and boosts saliva production. Saliva actually contains phosphorus buffering compounds.
Interesting.
Also, adding sodium chloride, just common salt, to the diet, maybe at around 1 to 4% of the total ration, can significantly encourage water intake.
Makes them thirsty.
Exactly. More water in means more urine out, which helps flush the system. And like we discussed with causes, making sure they have adequate vitamin A supplementation is important for maintaining a healthy urinary tract lining.
So it really boils down to being vigilant, managing that diet carefully, especially the mineral ratios, and making sure the environment supports good hydration.
Precisely. It means regularly monitoring the mineral content in both your feed and your water sources, avoiding overfeeding specific high-risk forages, like maybe too much alfalfa for male cattle because of its high calcium.
Hmm.
And in herds or groups known to be high risk, perhaps based on history or diet type, you might even consider proactively adding urinary acidifiers like ammonium chloride to the feed. But that should always be done under veterinary guidance, of course.
Wow. Okay. This has been an incredibly thorough deep dive into cattle urolithiasis. It's clear it's a really serious, multifactorial condition, definitely complex, and can progress frighteningly fast.
It really can.
But the good news seems to be that by understanding these complex causes, learning to recognize those signs early, and really focusing on proactive prevention, especially with diet and water, the impact can be significantly minimized.
Indeed. Understanding something like cattle urolithiasis, it really reminds us just how intricately things like diet, anatomy, and the environment are all linked in maintaining health. And that's not just true for animals, is it? It applies across all biological
That's
systems.
a great point.
It really makes you think, what other seemingly simple problems out there might actually have equally complex hidden causes? And maybe how much can we truly prevent in many areas just by better understanding those underlying connections?